How to manage hypoglycemia at home. What is hypoglycemia? Hypoglycemia is a complication of diabetes, when blood glucose level falls below 60 mg/dl or person feels dizziness, headaches, sweating, confusion, anxiety symptoms, which relieves immediately after restoring blood glucose level to normal, known as hypoglycemia. Hypoglycemia or low blood sugar levels can be commonly encountered by type 1 and type 2 diabetes patients, who are on insulin treatment, or those type 2 diabetes patients who are on certain oral anti-diabetic medication which increases insulin secretion from pancreas like sulfonylureas or other diabetic drugs. Why hypoglycemia is life-threatening. Prolonged hypoglycemia can cause permanent brain damage and in severe cases death. So it is important that hypoglycemia must be corrected immediately. Steps to tackle hypoglycemia or low blood sugar level. 1. History. If you find someone unconscious or having symptoms of hypoglycemia, always check their wallet to find any medical history for diabetes, or if the person is able to talk, ask him whether he is diabetic or not. If patient has missed his meals or undergone severe exertion, if he had sweating and hunger, and if he has become unconscious suddenly, then he could be in hypoglycemia. 2. Suspect hypoglycemia when symptoms of hypoglycemia differ from individual to individual. The symptoms of hypoglycemia are sweating, palpitations, dizziness, slurred speech, confusion, weakness, anger, etc. If patient is breathing quietly, pulse is slow, it could be hypoglycemia. 3. Call for help. If you are at home, seek immediate attention of your family member or colleague at office, because hypoglycemia can lead to confusion, slurred speech or even unconsciousness, and explain them about your symptoms. If you are driving a car, then stop and pull over. If you are walking or climbing steps, stop and sit down. Make yourself and others safe. 4. Check blood sugar. Check your capillary blood sugar level by finger pricking with glucometer. A reading less than 70 mg/dl with symptoms confirms hypoglycemia. If you do not have glucometer with you or symptoms are severe, then jump to step 5 directly. Every diabetic must have a blood glucose meter at home. 5. Grab sugar or fast-acting carbs. Hypoglycemia needs to be corrected immediately, so fast-acting carbs like simple sugars can be consumed. Take 2-3 tablespoons of glucose powder or sublingually, below tongue. This is an effective measure to cause immediate rise in blood your sugar level. 6. Other fast-acting home remedies include: half cup of fruit juice, 1-2 tablespoons of honey, half cup of soda or non-diet soft drink, 2 tablespoons of raisins, 5-6 hard candies, or 3-4 chocolates. 7. Recheck. Don't go on eating too much, otherwise sugar will raise much higher. Wait for 15-20 minutes and recheck your blood sugars again. If it is still less than 70 mg/dl, eat another 15 to 20 grams of sugar or glucose powder. Repeat this till sugar level goes more than 70 mg/dl. After hypoglycemic episode, try to eat meal within 1 hour or eat some high carbohydrate food if meal time is more than 1 hour away. 8. Seek immediate medical attention. If your body doesn't respond to carbs or you suffer seizure episode or fall unconscious, seek immediate medical attention. You might require intravenous glucose and/or glucagon injection, which can be given in emergency or casualty department of tertiary level hospital. 9. Prevention. If you are getting repeated mild hypoglycemic episodes or even one severe episode, consult with your doctor for adjusting your medicine or insulin dosage according to your lifestyle. Take precautionary measures to combat further similar episode in future.